Hello, everyone. My name is Dr. Cole Ryan with Freedom Physical Therapy and Fitness. This is episode number 3 on our podcast. We are joined by Dr. Tetyana Gammons. Welcome to the team. Go ahead and introduce yourself.
Thank you. My name is Tetyana, and I'm a doctor of physical therapy. And I was just recently hired to be a part of the team. And I'm super excited to be here. Thank you for having me.
Great. So we just brought on Tetyana. Like I said, super excited to have her on board. We'll go into what brought her to Freedom and really what we're trying to do different. So it's really exciting. We're going to start off, with her story. So Tetyana, just go ahead and tell us a little bit about yourself, your family, and then, why physical therapy.
Yeah, physical therapy is the profession that is amazing. And what brought me to physical therapy is the love for exercise and educating people. I'm originally from Ukraine, and I was a teacher in Ukraine. And when I immigrated to America, I had to start it all over again. And I thought, hey, maybe it's a great idea to combine passion for exercise and education and in physical therapy. So I remember at that time when I was trying to make a decision, my sister was in the medical field and she is a nurse. And she told me, hey, I think it'll be a great fit for you. Check it out. And that's what I did. I did a bunch of observation hours in different settings and I really fell in love with it. And that's how it all started.
Great. So give us a little history on kind of like, where you're at in life and, your family and what's kind of pulled you back into the profession.
You know what? I feel like it's so gratifying to be a physical therapist. I really want to make significant changes in people's lives. I am a strong believer that exercises and everything that we do will make a great impact on people's lives, on their everyday function. And we are helping patients to live better lives, pain-free lives without injuries. We help them improve and go back to their hobbies and work pain-free. So I feel like I can make a big change in people's lives. I think I can, yeah.
Good.
It'll be really fun.
So, Tetyana, just like myself, we're very goal-driven when it comes to the patient experience, right? So just trying to make sure people have access to good quality care. Faith, family, freedom, that's what we're about here. So we believe in the freedom to treat people how we want to treat them to get them the best outcomes. Very oriented in our faith, believers in Christ, and then also our family. So Tetyana, I know you're married, you have 4 kids.
Yeah.
Those are things that drive us each and every day as well. I myself have a daughter and a little boy on the way, happily married. So things that we really bring to the table is compassion and just a love for what we do and what we represent. So great. Any moments, injuries, or people that you've worked with that really, really stand out in your profession? Anyone in particular that you were able to get back to where you wanted to get them to?
Yeah, a lot of patients that I treated, they were able to get back to what they used to be. I'm passionate about all kinds of patients, especially I'm passionate about, athletes and patients that play sports. I play tennis and golf myself.
Yeah, great.
I treated some tennis elbows, some golfers' elbows, and we were able to get them back to, go back to play golf and tennis. Some chronic back pain. I had injury myself when I was in my 20s. I was able to treat myself.
Okay, what was that like?
Yeah, no, it was really, really good because, if you're PT, you have all this knowledge and you can help yourself. It's an incredible feeling. I treated my mom. She had the frozen shoulder, and she, till this day, she says thank you and how much, she appreciates me because she wasn't able to do anything with her shoulder. She wasn't able to do like simple everyday activities. And yeah, being a PT is very rewarding, really
Yeah.
rewarding in so many ways.
So she was telling me yesterday that her kids are very, very good at golf and tennis. So basically, I went into the evening last night and I'm thinking to myself, all right, can I take on her kids in a round of 18? I'm not entirely sure. Probably not. Sounds like they're pretty good.
Yeah,
But
I mean, they'll be. We're playing the tournament this weekend in Tampa, so
okay, cool.
it'll be
Both
really
your boys?
fun. Yeah, both of them.
Okay,
I'll be caddying for my younger son.
nice.
So yeah, no, it'll be really fun.
So you're gonna
And,
read the greens for him and everything?
yeah, I try to help a little bit, but sometimes they don't listen. You know, kids are kids; they just don't want to listen.
Kids are kids. Yep, I know how that goes. All right, now, so what ultimately drew you to our clinic, to Freedom Physical Therapy and Fitness?
You know what? I like the fact that we can treat patients without any limitations as far as insurances. You know, insurances cannot tell us what to do. We can take our time and look at the patients completely, look at the whole body, and I think that aspect is great because we don't see so many patients at the same time. It's a good quality care. You know, we spend a lot of time with one patient. Yeah, it's cash pay. We don't rush. We take our time, and I think that's really good.
Yeah, good. So, really the way we're trying to transition our clinic and our model is just what she said is the problem with physical therapy right now is it's so dictated by insurance companies and this insurance model and insurance. And instead of focusing on the outcomes or the results of what we do, we're focused on, I'll be honest with you, I'm focused on whether or not this is going to get covered. Am I doing this with a patient because it's covered or not covered, so on and so forth? Things that, we're just simply not able to do with you guys under an insurance model. And we really want to transition away from that. We'll give you a super bill, really, if we feel like it's appropriate when it comes to submitting for reimbursement. But we want the freedom to be able to treat you guys as solo clinicians. That's very important to really our independence, our autonomy, our skill set. So just making sure we're using all of our tools and not just what insurance has in store for you. So I was talking about it yesterday on the podcast that really when it comes to these outcomes, we focus on twice a week for 4 to 6 weeks. And if that doesn't work, then physical therapy doesn't work. And that's just not true, right? That's just not true. That's not everyone's built the same. Not everyone has the same body or makeup. So when it comes to physical therapy, it's really taking that individualized approach, which is difficult to do because insurance models are usually a cookie cutter approach. Okay, so it's very cookie cutter. It's so cookie cutter that we actually have to see 2 to 3 patients at a time, and you're getting the same stuff session after session. And you're like, why am I not getting any better?
Yeah.
Well, maybe it's because we're not loading enough or we're not progressing you, right?
Yeah,
so
no.
What's your experience with it?
I mean, I remember seeing a few patients at the same time, and I was overwhelmed. It's really hard to treat and provide good quality care, to patients, all of them. And in your heart, you want to provide the best patient care. So it's a really stressful environment. So I think what we're doing here is I'm a strong believer that it's better.
Yeah.
We are providing better quality care. It's very individualized, and we're taking time. We're looking at everything, the whole body approach. We're not looking just on one body joint. We're looking at a few of them at the same time.
Yeah.
So, and it's just better quality care.
Excellent. So let's go ahead and talk about, we talked about how our approach is different here at Freedom. And what excites you about being a part of this team now and just showing off your skills, and what's something that excites you about it?
Like a specific skill or like? What would
Just
be
the
like
patient
example?
experience.
Patient
Yeah.
experience.
What do you feel like you can show patients when they come in through the doors that they wouldn't get at the clinic across the street?
I feel like, what would you do? Like, what is yours? That's a tricky one.
No. So really what I do when
How
I
would you
have
answer?
patients come in is, hey, I'm going to show you quickly why we're different. So I'll use, I'll use the gal that I'm seeing right now for frozen shoulder. She was going to therapy for a year. Okay. She was going to therapy for a year. It was an insurance model. She felt like she was starting to plateau. I had a friend over there, a colleague of mine. She had mentioned us that I dry needle and sent her over to us. She came in for her first session. We did dry needling one time, and she felt immediate relief. So again, she was frozen shoulder, a lot of things going on with frozen shoulder, right? So immobile scapula, immobile glenohumeral joint, that's the frozen shoulder. Adhesive capsulitis, so it's just a frozen capsule. And then upper trap tension. So they're trying to get that arm up, tons of tension through there. That dry needling really helps reduce those trigger points, relieves that muscle tension. Good results after one session. She came back for round 2. And she said, hey, you know what? I want to go in on a package plan. I want you to treat me how you would treat me. I said, all right, great.
That's it. No?
So what do we do?
Yeah.
We'll typically start off, I'll do a little bit of shockwave therapy on areas of tenderness. So I tell people shockwave therapy is essentially high energy acoustic sound waves. And it essentially just melts away those adhesions. I like to say pain a lot of times. So basically the concept is, we're doing a light warm up with the vibration. We're doing our paint roller. So we're going up and down a broader tip, and then any areas of specific pain and discomfort, we're doing a paintbrush where we're just going over that area. Good results. Then we start to work through some passive range of motion. I'll take her through all functional range of motion here, and I'll just take her through that repetitively. We'll do some functional exercise, some resistance training, some overhead stuff. And then we'll come in, we'll do a little bit of dry needling, and she is feeling the best that she's felt. Wednesday was her 6th visit, the best she's felt in over a year.
That's incredible. Only in 6 visits were able to improve her so much.
And so this is the model that we're trying to follow, where it's just free flowing. Hey, you know what? This is what I think we should do. Okay. I don't have to think twice. Oh, is this going to be covered by insurance or not? I don't have to think twice about it. I'm just doing it.
The results speak for themselves, When people see the results, they come back.
Exactly.
Definitely.
So it's the experience. And again, like I told you, I'm showing people everything I can really get done in a 45 minute treatment, right? It'll blow your mind. You're not sitting here doing external, internal rotation, maybe some shoulder pulleys. Like, we're not just doing that for 45 minutes.
Yeah.
We're putting in the work.
Exactly.
And we get the results from it.
Very individualized approach with the amazing, latest techniques like dry needling, shockwave therapy.
Yeah.
I see a lot of people, a lot of PTs using those, and they have great results. So it's great.
So the shockwave, another great one when it comes to treating tennis elbow and golfer's elbow, like you said. So shockwave is essentially going to be, at this point, I would say a gold standard when it comes to treating tendinopathies. So that's what golfer's elbow and tennis elbow is it's lateral and medial epicondylgia, which is the tendinitis there. So really a gold standard for treatment now. So come check us out, guys, especially if you're dealing with any kind of tendinitis. That could be Achilles as well. We've got tons of research out with the Achilles and shockwave therapy.
That's great.
So, okay, great. So let's talk about, types of patients that you've had experience with working with. So, orthopedic, neuro, what's some of your experience in?
We worked with all kinds of patients. I remember working with chronic back patients. Those were really challenging ones because they don't improve, quickly.
Right.
So you got to be very creative. We had a lot of frozen shoulders, rotator cuff injuries, patellofemoral pain, post-surgical patients. So you basically treat them with exercises and manual therapy, and they get better.
Yeah, great.
Yeah.
So I want to touch on what you just talked about. So manual therapy or sometimes massage therapy, let's be real. Soft tissue mobilization is what we call it. The reason you're not seeing as many therapists do manual and massage techniques is because the insurance, right? So the insurance companies,
Wow, yeah.
they pay the least amount for manual therapy. That
And
seems
that's stuff that really works.
that's stuff that really
Yeah.
works. It's really helpful, especially when it comes to pain management. So that's just another tidbit of information for you guys that, a lot of people obviously wouldn't know that information.
Oh yeah, for sure.
So from
I
a
didn't know
business
that.
side,
Yeah.
manual gets reimbursed at the lowest rate. So you're not going to have too many therapists, unfortunately, doing manual under an insurance model, right? So, no, that's great. You can hear obviously from your stories that therapists, we generally speaking treat a lot of different conditions. Sometimes I'll have patients call me up and they're like, "Do you treat the knee?" Yeah, absolutely. Do you treat shoulders?
Yeah.
Absolutely.
We
Right?
treat headaches, right? We treat balance disorders and Parkinson. We treat a lot of many conditions.
So now do you have experience with Parkinson's? What have those experiences been like?
You know what? I've seen a few. We were mostly doing LSVT.
Okay.
Like
cool.
big motions, big, and also like manual therapy, stretching, a lot of stretching. Yeah.
So talk to us about the stretching, the technique that we were discussing.
Yeah, we were doing a functional massage, which is stretching with movement. So you stretch the muscles with the joint, you're moving the joint, and you're providing the massage at the same time. So that is really, really great techniques, and they really elongate the muscle and increase range of motion for the patients. And they feel really good after that.
Yeah.
And functional massage, some stretching, like a muscle energy technique where you contract and relax the muscle. Those are great too. And yeah.
Great. So lots of different techniques out there. Generally speaking, your physical therapist can treat a lot of conditions, right? So we went to school for a long time, guys. I don't know if anybody knows this, but we're doctors in physical therapy. So we went to school for a long time. And, that education, that knowledge, that skill set it is valuable, right? Especially if you go to someone and you have these expectations, right? And that's fine to have them, but also, an insurance model is difficult to fall, within those skill sets. So with that being said, we're trying to do something much different than a traditional model. We treat a lot of conditions, and we treat them with this level of knowledge that a lot of doctors of physical therapy have obtained over their education, their clinical experience, and then continuing education as
continuing, well. Exactly. There's so many certifications. Dry needling is one of them, and we know a lot.
So Rocksteady Boxing,
golf,
right? That's another thing. Yeah. Golf, TPI
golf,
certified. So there's plenty of education and a lot of skilled therapists out there. Okay, so great. Let's go ahead and move on to how do you educate clients so that they feel in control of recovery? And I'll give you just a little bit of a backstory. We have a lot of clients that come in, or patients that we talk about 4 to 6 weeks. And they come to you and it's 6 weeks and they're like, I'm really not feeling that. I'm not feeling that great. How do you educate clients on the overall experience that, hey, you may not obtain your goals within this 6 week time frame?
Yeah. 6 weeks is, not a lot. So it's just the beginning of your journey. You have to, maintain what you gained. You have to, keep exercising, go to the gym, come back to us again for some, touch up, improve. So you maintain the improvement, and you have to make it your lifestyle, right? Like all the exercises that we give you, you got to keep doing them, because we may do so much in that time of period, only 6 weeks, but you have to maintain the progress by doing the work on your own.
Right.
So
So
what do you think?
when we give people exercises to do at home, it's very important that you do them, right? So
Do your exercises.
Do your exercises. I tell people I only limit the amount of exercises I give people to 2 to 3 exercises.
For sure, yeah.
And the reason being is they've literally done research on compliance levels at 2 exercises, 3 exercises, and 4 exercises. So
yeah.
Not to call out chronic low back pain, but they are the least compliant individuals. And, it's understandable. You guys have been dealing with back pain 20, 30, 40 years. And you're like, you know what? This exercise isn't going to do anything for me. Do it for 8 weeks as prescribed, and then come back and tell me it doesn't work if it doesn't work. But the big thing is trying to comply with what we prescribe you. It's no different than really a blood pressure medication.
Yeah, it has to be your lifestyle. You have to do exercises every day, and like some people go to the gym every day. I do myself, and I feel great. I don't have, like I said, I used to have a back pain, and because I go to the gym so much and do all the exercises, I have not had any back pain in a long time. It's completely gone. So I'll be honest with you, it's hard work. Exercising is hard work, but if you make it habitual, you're gonna like it. It's gonna, bring some happy chemicals, and you'll feel happier. You're gonna feel good. You're gonna be proud of yourself. You're gonna feel accomplished.
Good.
And it has so many positives, right? Your brain will be clear. You're gonna be feeling the best, and you're going to live a long, long life. So exercises are great. So just do them. Don't skip.
Don't skip. So exercise is key, like she just said. And this is some recent evidence. Exercise is actually found to be more effective in treating depression than antidepressants.
Oh, yeah. Don't rely on medications. You can... just by simply going to the gym, you're going to be so much happier. You're not going to feel anxious. You're going to get rid of anxiety. It's such a natural way. You don't have to put anything in your body that has side effects. I'm a strong believer.
Excellent. So I want to go over just something real quick for the audience, because I think this is really good. If you don't know what to do, if you have no clue, you could try this challenge. All right. This is, I think it's 30, 12, and 3. Okay. So you do it for 30 minutes on an incline of 12 on the treadmill, and you do it at 3 miles an hour. Do that 3 to 5 times a week, and you'll notice a huge difference. It's become a trend that it's become real popular, I guess, on a lot of social media, TikTok, things like that. So try that. It's 30 minutes on the treadmill with a 12% incline at 3 miles an hour. Try that, guys, right? If you're just not sure what to do.
And honestly, when you exercise regularly, it becomes so addictive that you want to go back to the gym all the time. You just have to go and make yourself go for the first month. And after that first month, you'll be just craving it. Your body will crave it. You're just going to want to go, and it's just the feeling you get from it. It's incredible. Yeah.
And we're here to support you, guide you if you need that level of
If you have any questions, let us know.
Yeah, absolutely. Okay. Next one, last one. We'll go over a couple rapid fire questions for you. Golf or tennis, which is your favorite?
Tennis.
Tennis.
I know, it's a hard one. Okay. I had to pause for a second.
Tennis is her favorite sport. How long have you been playing tennis for?
For 7 years.
7 years. Mm-hmm. Okay, excellent.
It's a great cardio, guys.
Great cardio, tennis. right? Pickleball, you pickleballer?
Pickleball, I play pickleball sometimes with my kids. It's really fun too. But
Yeah.
tennis is number one.
Tennis is number one. You
Still
heard it.
number one.
All right. Favorite things to do in Naples with your family?
Golf and tennis.
Golf and
Same
tennis.
stuff.
Excellent. Now, where do you guys usually play tennis at?
At the Grey Oaks Country Club.
Oh, cool. Excellent. Very
It's
good.
a great facility.
All right. And then what's something that, clients may be surprised to know about you?
I had an answer in my head when I was reading the questions, and now I forgot all about it.
That's okay.
The most surprising?
So she's Ukrainian.
Oh,
but
yeah. That's what I was going to say.
She does also speak Russian as well,
speak
right?
2 languages.
Yeah.
I mean, total 3.
Three
Ukrainian,
technically.
Russian, and English. So,
Yeah. Great.
That's really
And then if you weren't a PT, what would you be doing?
I would be a teacher or a professional tennis player.
I love it. I love it. So that's really part of what we do is education as therapists, right?
Yeah.
We're trying to educate you guys and teach you how to be independent and be more functional out in your daily life. So, all right, that concludes episode number 3. Dr. Tetyana Gammons, thank you so much for joining me. Do you have any final words for our audience?
I mean, come to see us. We're going to be the best for you. We're going to treat you well.
Yep.
Be a part of the family.
Part of the family, part of the experience.
Yeah.
Thanks, guys, for watching. God bless. Have a good rest of your day.
God bless.